Hi, I'm David Liew from Melbourne, Australia, and I'm reporting here from Philadelphia at ACR 2022. It's really lovely to be here in person, first ACR back, see lots of old friends. It's been great. The scientific program started today though, and there's been lots great on the poster floor, the virtual poster floor, particularly in the rheumatoid arthritis space. I want to tell you a little bit about some work that I've seen evolving over a couple of years, looking at recurrent neural networks and MRIs. And so what does this mean? Well, we can essentially, in broad terms, use artificial intelligence to try and piece together whether a patient has rheumatoid arthritis or psoriatic arthritis just from the MRIs of their hands. And so this is what's been done by some German investigators. 502 patients, about 1/3 of them seropositive rheumatoid arthritis, 1/3 seronegative rheumatoid arthritis, and then another third psoriatic arthritis. I guess we're always concerned that seronegative rheumatoid arthritis might blend into psoriatic arthritis, but they compared the three groups and tried using unsupervised techniques to try and determine whether the algorithm could differentiate those three groups. And actually, really quite pleasingly, the algorithm was able to differentiate seropositive rheumatoid arthritis away from psoriatic arthritis, just based on hands, just as well as it could from seronegative arthritis, seronegative rheumatoid arthritis and psoriatic arthritis. And so a few things. Firstly, it could actually tell where on the scan made the difference. And so importantly, we saw enthesitis and soft tissue inflammation that would correlate with tenosynovitis as key differentiators between the rheumatoid arthritis groups and psoriatic arthritis. But you can imagine the implications. Now, I don't want to get too excited, and the performance is definitely not perfect. I don't think this can stand up by itself, but you can imagine this as a triaging tool in situations with our rheumatology workforce shortage the way it is, where we can't get patients to see a rheumatologist as quickly as we'd like. MRI scans may be more accessible in some parts of the world, and then to be able to use an algorithm like this to be able to differentiate patients down different pathways might be enormously powerful. You can also imagine though, in the future as we go along, maybe this as part of an overall assessment may be part of better phenotyping patients in general. We put a lot of labels on patients depending on what we see. Psoriatic arthritis maybe just because they've got a bit of chronic plaque psoriasis, even though we're not necessarily sure whether that relates to their small joint arthritis. And maybe it's all part of a deeper phenotyping process that we're working towards. There's been a lot else at this meeting on better phenotyping. It's been really exciting from that point of view. And so I hope you join us at rheumnow.com for plenty more about rheumatoid arthritis and everything else to do with this meeting.